There's a variety of plans that you can follow for prehab prior to surgery. A general guideline, a number that we like to shoot for is 150 minutes per week of physical activity. We want to try and get to that number. And that can look a lot of different ways. That usually we like to have that involving some degree of both aerobic or cardio fitness activity, as well as strength and resistance training. It can also include a variety of intensities from low, moderate to high intensity. Because of different medical conditions and maybe different medications that people tend to be on, a lot of times heart rate is what you'll typically see people kind of measuring and gauging how intensely they're working out. Not always the most reliable in every patient population or every population in just in society in general. So a measure I like to use and recommend is called the rating of perceived exertion, or RPE. And this is essentially just a fancy way of saying a scale. So there's a few different ones out there. The one I like to recommend is just a simple scale of 1 to 10, where 1 is, very leisurely, low impact activity. Don't really have to think about it much. And 10 is a full 100% max effort. For low intensity, you're somewhere in the 2 to 3 range. For moderate intensity, you're somewhere in the 4 to 6 range. And for high intensity, you're somewhere in the 7 to 8 range. And so essentially what you do is, as you're working out, exercising, you just ask yourself, how does this feel on a scale of 1 to 10? And that's how you kind of will gauge what intensity you're working at. And that's just a simpler way, easier way to start as you're just kind of getting into this stuff. From a general guideline standpoint, from a plan, can look, again, a lot of different ways. A general one we like to recommend is a variety of settings. So you would have usually about 3 times a week, you do some moderate to high intensity aerobic and strength training supervised by a clinician, whether that's a physical therapist or someone with similar credentials. They're kind of overseeing that aspect of your prehab program. And then 4 days a week, you'd like to try and get into that low intensity range. And so that's just increasing your physical activity essentially. And that can look like a lot of different things. It could be, gardening, it could be walking, it could be stairs, something that you enjoy that gets you working and gets you moving. That's in that low intensity, maybe a little bit more than just leisurely, where you kind of feel like you're working, but you're not, draining yourself necessarily. So again, in that 2 to 3 range.
And exercises that people can expect or anticipate when they get into these programs are really about improving function. So engaging big muscle groups and what would be considered functional patterns like push or pull or carrying things, basically demonstrating activities of daily life and preparing the body to be more efficient at doing these things. So a lot of the loading that you'll be doing through the strength protocols are in a rough rep range of about 8 to 12 repetitions. We know that if you overload the tissue, you're going to generate an adaptation. So we're trying to get the body to stimulate growth through stress. And ultimately, we're putting stress on the tissue through strength. And so those reps are going to be crucial for that. So getting to a point where the last repetition is harder than the first repetition, that's an easy way to know that you've overloaded the muscle to drive these changes from it to generate the strength curve that we're trying to get from the exercise protocol. And again, basic activities like lunges or pulls or pushes, again, simulate activities of daily life. And so that's going to improve quality of life as well.